name is Ted Vanderkooy, General Surgeon with Muskegon Surgical Associates. It looks like your regular doctor thinks you have a thyroid goiter. That's certainly something you need worked up and looked at. In my office, we not only can do a physical exam, but we also do office ultrasound, which we can do right today. And on ultrasound, we can tell how big the mass is and whether it should be biopsied. And in fact, the ultrasound helps us biopsy this mass to determine whether it's cancer or not. If it's benign, then we can likely simply follow this mass in your neck. If it's malignant or cancer, then you need that removed. So it looks like the biopsy results came back as cancer. The good thing about most thyroid cancers is that they are completely curable. It does require removal of the tumor along with the thyroid. Quite likely we would have to remove the complete thyroid gland. Sometimes with a small tumor we may just remove one side of the thyroid. Thyroid surgery is quite common. In proceeding with thyroid surgery, you come to the hospital, the nurses start an IV, anesthesia would put you completely asleep, and what we would need to do is make an incision following some of the natural lines in your neck. The incision is 3 to 4 inches long, and through that we're able to get out both sides of the thyroid. We call those the thyroid lobes. So we each have a right and a left thyroid lobe. And like I'd mentioned, most cancers require removal of both sides of the thyroid, but if it's small, sometimes we just remove one. After surgery, you would be in the hospital usually overnight. Occasionally, we send patients home the same day. Yeah, so the thyroid makes thyroid hormone, and that is necessary to replace. So if we remove half of the thyroid, then you won't need any other treatment. The half that remains will be sufficient to provide your body with thyroxine, which is the thyroid hormone. However, if all of the thyroid is removed, then you would need replacement hormone, a medication such as Synthroid, and that is a medication you take usually just once daily, and you would have to take that for the rest of your life. Every surgery has some risks. When we do thyroid surgery, there's always a chance of infection, chance of bleeding. The other risks of thyroid surgery involve possible injury to nerves that go to your vocal cords. It's quite unlikely. Perhaps 1 to 2% of patients will have that complication, and quite often it's transient and gets better on its own over time.